Well, good afternoon. My name's Dave Shook. I'm the director of the Department of Jail Services, and today we're going to give you a little bit of an update. I know as a part of the new year, we provided a pretty extensive packet of information that has hopefully been helpful in illustrating and explaining many of the things that the jail is constantly working on or managing through our time. So next slide, please. So every year we put together a general demographic slide of what's going on in the jail, what we've experienced over the last year. And of course, this is kind of the summary of that. As you can see, our bookings and releases, they generally are pretty static. So the amount of bookings we have a year are very equal to the amount of people that we release every year. So that's why the numbers don't fluctuate very much on a daily basis. As you can see, our average daily population generally stays above the 80% mark that we'd love to be at, which we can't do because of the amount of inmates or arrests that are happening throughout the community. And of course, one big change on this one is our average length of stay has changed from 27 days to 22. So that means we have a lot of bookings and releases and other things that are happening. Oftentimes, we have about 44% of our inmate population that's there less than 72 hours. So the other 55% are there much longer. As you can see, race and ethnicity, the gender, those don't change much. 20 to 22% female population. As we move them around the facility or keep them in various places because it's such a small population. And then, of course, the age groups. Not much changes year to year. As we go along with that, some additional information I'd love to share with you. We generally have a pretrial population, somewhere in that 90 to 92%. That hasn't changed much in the last 2 years. And 92% of those, as of Monday, were felony type charges. That's at least their initial primary charge. 20% of those are in our max areas. That's the most secure, those slider doors that you've all seen. And about 25% are in the medium range, which is that little less security, but still needing to have additional security. And 46% are in that minimum level. We oftentimes have about 20% that indicate themselves that they're homeless somehow. And so that population, depending on the day, it may go up a couple here and there, but those individuals self-identify as that. As you might have heard in our previous meeting, about 28 to 30 inmates are at some sort of a TOC, temporary out of custody. So that's usually the state hospital up in Eastern or Western Washington. We usually use the Western Washington, but they're out of our location, which gives us a little bit of flexibility, not much. We currently today have 512 inmates assigned to this jail, and 15 of them are over at Skamania County, and that's a pretty consistent number for us. And it's additional buffering opportunity for our local law enforcement partners to be able to bring more arrests to the jail. On this slide, there was a little bit of an error as we were changing. Jail Services hasn't been around since 2019. Those slides or those numbers actually would have been under the sheriff's office at that time. So the LE arrest or the total is correct. And as you can see, what happens through the year and the numbers and how we get these booking numbers and averages, it comes through our pre-booking process. So Officer A arrestee A, they come in, that's a booking number. And so we oftentimes will have the city of Vancouver, the sheriff's office, any law enforcement entity that they watch our daily jail roster every day, and they see names of people that they're looking for, and they quickly call the jail and say, hey, we have a case on so-and-so. So those numbers also increase, not just through the booking process, but also through the court process. So as you get to the year 23 and 29, where it does talk about the jail services and those arrests, those are referrals that come from the courts. So every time somebody gets arrested, they're required to be brought down and rebooked and added those charges to them. And so there's an additional booking effort and process that happens with our staff. And as you can see, COVID affected the jail population. Pre-COVID, you would see bookings through a year, somewhere between 13 to 15,000 of these bookings and rebookings. Since COVID and just the daily jail population, it went from a 640 plus number to 240 plus number. And you can see the significance of what happened there and the opportunity to reevaluate the jail. There's sometimes questions about, in fact, I was just asked this question about, we used to house 700 inmates. Why are we not housing 700 inmates today? Well, constitutionally, we're required to have 35 square feet per person, which is that buffering for any individual that's locked in a jail cell. And the current jail was built in 1984. So it was pre-ADA, it was pre all best practices. And again, as we talk about those remodeling efforts, those are some of the things that we're trying to improve. Next slide, please. Some of the things that when we started 2 years ago, the sheriff's office previous to us, they had, again, a population in the mid 600s. The jail at the time was 32 vacancies. And as you can see, the application numbers were not as high as they are today. Since January 23, we've had over 800 applicants to apply for the Department of Jail Services. The actual number is 881. About 57 of those were laterals. One thing that happens is about 50% of those are quickly eliminated for very basic reasons: criminal history, driving history, job history, those kinds of things. And so we're able to get down to the better candidates that have applied. But as we continue to look at those, we continue to add different hiring efforts, getting into the public, being more localized, looking for the right candidates to join our team here at Clark County. So any questions about that at all?
Sure. Just quick question.
Go ahead.
I'm curious. So we have 40 newly hired officers.
That's correct.
What have we lost? What is the net?
Yeah, so the net is about 30.
30.
Over those 2 years, we've lost about 10 employees to retirement or other job opportunities or leaving the facility. And so, like the sheriff, like many police agencies, you have just as many employees retiring sometimes at the same time that you're hiring them in the door.
Good.
But it's about a 30 number, and depending on the day, I think I heard today we had 2 more that move forward into the hiring pool, and we have about 36 individuals going through current backgrounds right now. Hopefully 50% of them will make it through, and we'll get them on. So
good. I'm glad that's
it's about a 30
low
plus
number.
Yeah,
I was hoping that it would be. Thank you.
About a 30. Next slide, please. So you might have seen this slide earlier, but for the public, just to kind of see the kind of effort that would love to come into the jail. And as you can see, the purple or the blue numbers up on top are all the law enforcement agencies that would love to arrest people and bring them to our facility. As you look through there, the green are the courts and the court systems. And again, whether it's therapeutic courts or the superior courts or others, they are referring people that get come to our jail one time or another. As you move around the circle there, the yellows are the court competency, the DCR efforts, and going on with the inmates that are inside of our facility working through those processes. And then the purples there, those are DOC and warrants from outside of our facility and our community sometimes. Currently right now, we're not accepting all DOC warrants or holds, as they would call them. We're only accepting the most egregious individuals, and that's they have to call us and we talk about it. And when they bring them, they actually move them off to a jail up in Chehalis, where they have a contract with them. Just due to the amount of lack of staffing, the lack of bed space, it was just something we were unable to continue at this moment so that we could then focus on our local law enforcement. Next slide. So some of the things that we're working on, and again, these are some long-term projects. As you can see, the very first thing, we've added 28 funded positions, some through the mental health sales tax, some through our public safety sales tax efforts. And each of those positions, especially the mental health sales tax positions, they're specialized. They're going to be specialized in reentry and MOUD efforts. And so again, you've seen slides where I believe we're not talking about it in this presentation, but up to 74% of our population are experiencing MOUD and SUD issues where lawsuits and other court cases are driving this to an ADA kind of requirement for jails. It's not a we would like to or whatever. It's a no, this is a requirement because of the epidemic of fentanyl overuse and substance use issues. And so, again, as we continue to improve what we're doing here in the jail, we are absolutely full. Every space, nook and cranny has some officer, employee, or program being crammed into so that we can add one more person being serviced. And so, again, as we continue to look at that, in about 2013 or 14, HPOD was mothballed. It has some security issues that we have to fix before we can open that up. It's a minimum level security area of our jail, and we have to make sure that it stays, inmates stay in where they're at. And so, again, it's taken a little bit further time to get those pieces and parts and those employees hired to actually open up that space. As I mentioned earlier in this morning, when we hire one officer, that doesn't allow us to open up living spaces. We have to cover 24/7, 365. And so that's usually 4 officers on 24 hours a day. And so again, that allows for us to open up new spaces. And we're definitely looking at it. The 30 officers actually filling in other priority holes in the main jail safety and security aspects for us. So again, we're almost there. We're real close. We have 10 recruits getting out of the academy on the 27th of this month, and they're going to fill in some very critical holes for us to be able to move forward on some of these projects that have been kind of waiting on. As you know, you've approved a 64-bed facility down at our jail work center. First time since the jail work center was open that we've actually added a living space. This will be critical for not just added spaces, but also the opportunity to move through our transitions as we hopefully get to remodel a new facility. My partner to my right here, she has been working real hard on Medicaid. The waiver here in the state is an unknown endeavor. The federal government, as you know, moves in interesting ways, and they don't have the answers a lot for the state folks that are trying to implement this program. However, we are in the first cohort, which allows us to be guinea pigs, but also help drive how the system should be working. And that should be able to help us create and add different medical opportunities and facilities and other, not facilities, but other aspects to our own facility that we currently can't do. We just don't have the room, the space, the volume, the expertise, and the medical staff to do those things. So again, as that continues to work, we actually haven't used any of the monies the state or the feds have given us yet, just in case things explode or implode. So, but we are moving forward. They actually are having more answers today than they've ever had before, which should help us move along. We're looking for some external partners that would help us with maybe Medicaid billing and other aspects of this program, which are going to be quite extensive, not just for any organization, including our own, to create this program, but also to follow up case management and some of the extra things that happen to inmate population once they leave our facility. We can control within our 4-year walls, but once they leave, there's some rules in these laws that require continued care. And so those are some of the things that we're working through, and we should have some more answers from HCA and the federal government as we move forward. Just weeks ago, we were reapproved to be an OTP site, which is ability to give methadone to inmates. We have OTP sites in Clark County. I think both are in Vancouver, city of Vancouver, but it allows us to be able to provide all medication for the inmates that are going through SUD or different aspects with MOUD. So super proud of that. I believe we're the only jail in the states, even though the state's changing some of the rules about allowing other jails to do that. We're the only jail in the state to have gone through that process twice now.
Nice.
Yeah. Anna's going to talk about grants on the next page, so I'm going to let that kind of go on. And then currently we're looking at, and again, whether it's inmates, families of inmates, different torts and other things, medical and mental health is always a topic of discussion locally, nationally, statewide. We are evaluating our current model of care and how do we do that? How do we provide that? Partnerships externally, internally, just finding the right aspects so that we can provide the best care that we can while individuals are inside of this facility next door here. It's a critical piece. And again, we should be able to provide the right kind of care. So we are moving forward with those evaluations, analysis, and things. We've been to Spokane County. We're talking to other counties how they do that kind of stuff, but we're not quite ready to move forward. And we're definitely in the infancy stages of that kind of a conversation currently. I would like Anna to kind of talk about our growth. And again, as we look at different things in our programs, we just don't look internally at our own funding sources. And Anna has an expertise in grants and other things. And so if you could speak about our expansion in that for a bit.
One more again. Good afternoon. My name is Anna Lookingbill, Jail Transition Manager, Clark County Jails. Hello. Good afternoon. My name is Anna Lookingbill, Jail Transition Manager for Clark County Jail Services. I was asked to spotlight some of the grant-based efforts that we've made in the last about year and a half to continue to expand services within Clark County Jail. Certainly, we recognize the tremendous acuity of the population as well as the volume of need. You've heard us speak to how we eclipse the need of the current capacity of all mental health treatment agencies in the county, all of our substance use disorder partners. If we were to take everyone in the jail who passes through our system in a year who have levels of need that those providers offer, we would fill everyone's services completely. So I think it's always worth recognizing that even though we continue to make these amazing efforts to move forward, because of how staggering the volume is, as well as the acuity, other efforts will need to continue to be made, which is why Director Shook is referencing ongoing conversations regarding our overall models of medical and mental health care. Specific areas of growth, you can see I've highlighted everything that is 2023 forward. We've been able to continue to scale up services around opioid use disorder. It has been recognized on par with ADA. Earlier in my career, folks would talk about medications for people experiencing opioid use disorder. So examples, terms people may have heard are things like Suboxone, buprenorphine, methadone, naltrexone, right? Those are some of the medications that you hear spoken to. There's a recognition that people that are using opioids, which has been exacerbated by fentanyl, can be significantly treated by these medications, and that it reduces risk of death. It does all kinds of things. And so what's interesting in recent years is that that has been considered on par with the American Disabilities Act. And so it's shifted from this might be a nice recommendation for someone who's in treatment into how critically valuable this resource is. One of the challenges that you have heard us speak to often is that these weren't things that were initially considered or funded. There are also operational and physical space challenges. And I know we've had this discussion many times. Yes, we may want to serve, our best guess is 252 people on any given day experiencing opioid use disorder in Clark County Jail. And we have to have a physical location to do that. We also have to have the security staffing and the officers for those medical needs to be met in a way that's safe, that aligns with facility requirements. And so even though it does often feel overwhelming with the scope of need, we continue to try to seek funding to provide services in that way. We are in the first cohort funded by the Washington State Healthcare Authority for their MOUD in Jails grant. That program is still operational and provides the bulk of our opioid abatement, or I'm sorry, our opioid related efforts. We also are in the process, actually, I shared this with Director Shook, of getting a little bit of additional money from the HCA to pilot the use of injectable buprenorphine. So that will be a small pilot group, but we're really looking forward to being able to offer that medication in the facility. We're also recipients of Opioid Abatement Council funding, and then tremendous honor from the mental health sales tax funding to actually be able to utilize some of that toward officers. So that's the first time we've been able to do that. Having that security component is critical to scaling up efforts for these other types of services. You can see the reentry program has been busy. In the last year and a half, we were able to secure a number of different types of funding. Sometimes that money comes into the county and passes through us to another partner. Sometimes that funding is funneled into the partner organization and then services are provided in the jail. We try to be very flexible and creative about how we do things. And then we're always making sure that the services we're offering are best in alignment with the needs of our current jail population. I've been involved with the reentry program now for almost 10 years. Our services look different. Our need has become more acute. We're focusing heavier on basic needs areas, things like housing, referrals to drug treatment. 10 years ago, we got to talk about things like employment because people had more access to services that were meeting their basic needs. It's not that those areas aren't of value, it's that these other needs have become so critical and acute in the population that we're seeing. So you see a variety of partnerships. Some of those are centered around naloxone and naloxone provision. Again, a nod back to the overwhelming impact of the fentanyl epidemic, wanting to help people if they do experience overdose upon release from the facility. And then you see a small effort, but a significant one regarding officer wellness. It's interesting to note that often when officer wellness funding becomes available to different sources federally, statewide, if you look close, it's often only for law enforcement. And certainly we're thankful that law enforcement wellness efforts are increasing, but correctional agencies typically cannot apply for funding. Correctional agencies are not seen as being part of that officer wellness cluster. So it's fairly significant that this is the first year CJTC actually made funding available to corrections agencies. We will be offering, actually coming up pretty soon, full day staff wellness training, voluntary, for the first time for our officers. And then additionally, we were able to get into a pilot project that has to do with peer support training for our team. So really trying to make sure that we are caring for everyone in our facility, folks that are incarcerated with us, but as well as our staff. Next slide, please. Again, this is just another way to talk about some of the growth that we've been experiencing. You can see what the reentry program looked like in 2024 and what it looks like in 2025. Certainly, we are continuing to add positions. The positions on the, I guess it's my right hand, the 2025 graph that appear to be sort of sketched in, those positions are yet unfilled. Some of them we're actively working toward filling. Others will be filled, specifically the officer positions, in alignment with some of the staffing efforts and operational efforts that Director Shook was describing in other areas of the department. That growth in MOUD officers on the furthest side, that will also be tied to implementation of services required under the Medicaid waiver. So these things are often hooked together as we have more information about how we're going to implement Medicaid, what those requirements are going to look like, as some of these other areas of operational need, HPOD, JPOD, receive their staffing, we will continue to pull officers over into that MOUD area.
I have a quick question.
Yes,
So
ma'am.
those shaded area boxes, are those positions funded?
Yes, ma'am.
Thank
They
you.
are funded, but they do not have human beings attached to them yet. You will also see two positions on the larger box in the sort of left top corner. Those are limited term positions. That mental health coordinator will be instrumental in helping us build a framework to bring before the Mental Health Sales Tax Board. We are interested in seeking funding to license as a behavioral health agency to provide internal clinical mental health services in Clark County Jail. That is a significant step and needs to be done very thoughtfully and in alignment with licensure requirements. So that position is building the framework, which would then be presented for additional funding. And then you see a specialty position to help us fully implement that Medicaid waiver process. So yes, a lot going on. We are very busy and very proud that we're being supported in the work that we're doing. Next slide, please.
Go ahead. We have a
Yes.
question up
No,
here.
go ahead.
Yeah, one real quick question for you. So I can't see. So the mental health implementation coordinator, okay, and the Medicaid implementation coordinator, was that one that was funded by the mental health sales tax?
Yes,
So, and
sir.
I can't remember, I was involved in that process, but I don't remember, is that a temporary position, or what will that roll into something else, or will that FTE end?
Yeah, they're 2-year project positions. And again, it's to help create, build, make the analysis, determine what we would need, right? So that we can assess it with what we're currently doing. And just to add just a little more context, we currently, with our mental health providers, they do a lot for our jail, but they mostly focus on crisis when people come in the door, suicide watches, and the very basics. And because we don't have a full program, I mean, we have contracted services, right? But not quite enough. And so again, we're looking at, first of all, how do we improve those services, or how do we add to it, or make sure the program is fully, and again, we use Spokane County as an example of what we could have. And again, we want to assess it first and determine, is that the best practice moving forward? There's very limited ways of providing medical and mental health services inside of a facility. You contract for it, you hire it, or you partnership with local healthcare facilities. Those are the three methods. We've historically contracted with a national vendor. There's not many of them out there. You see them in the news occasionally. And so again, we're trying to evaluate how we can maybe better do it or improve our current systems of doing it with our current vendor method. So I don't know if that was helpful.
Yep.
Okay.
No, that answered, yes. Thank you.
Okay.
Counselor Little?
Yeah, thanks. Previously, you had mentioned that there was some federal and state funds that you are holding or haven't used yet. I was just curious what that amounted to, and I assume it has to be spent by a certain time. And I'm, of course, curious whether that could be applied to any of the funding that we need for the extra operations for the
Of course.
jail remodel.
Yeah, so currently it's for Medicaid and it's for building infrastructure with IT programs. It's building other infrastructure components. And again, before we know which direction we're going to move with that and what we need to move with that. Now, some part along the way, when you get into the Medicaid, there is some funding that would come along with potentially Medicaid to provide support services and or medical, I think, right? Is that?
Medicaid funding typically is for medical,
Yes,
clinical type
medical,
services.
clinical stuff.
It doesn't typically allow operational. We can't build a wall, right? I can't build a tower with Medicaid funding. We can hire a nurse.
Right. So there are some, but the funding I think is just not just, but it's $100,000.
Correct.
Yeah. So
And additional funding will be applied as we hit different milestones within the project.
there's quite a few counties that have jumped back out of the cohort, and the state's now like, hey, could you give us our money back? And they're like, oh, we spent it. Right. And so again, we're just trying to be very judicious with our finances and making sure we're doing the right thing before we move forward. So more study.
Great, thank you. Just wanted clarification on that.
Next slide, please. So these are the things that we've been working on. And again, it's not always about us, but we need to make sure our own internal processes, programs, procedures, employees, all that is pretty cleaned up. And so sometimes we don't control the courts, but we have to have relationships and partnerships. And sometimes, whether it's documentations, processes, or efforts, we can work together better. And so that's what we've really done over the last 2 years, is opened up lines of communications for our external partners. So for example, we've been talking with our law enforcement partners, asking them about what kinds of diversion efforts and processes there are. Back in 2021, I believe there was a countywide diversion process for mentally ill or mental health, and where that moved to and what agencies were doing as a part of that. I wasn't able to make much ground wave on that, but we're continuing with those conversations to figure out how can we create better diversion opportunities. So diversion is ITAing folks or taking them somewhere else as associated. There's a list of crimes or arrestable crimes that are sometimes arrested or cited into the mental health courts and some other places, but oftentimes the easy button is to bring him to the Clark County Jail and leave him there to move him somewhere else. And so it's an interactive process conversation. I've heard that some looked at this evaluation that was done in 2021 and they're like, well, we do some of those things, but not all of those things. And again, it's a choice, and just trying to work with our partners to better understand how we could more effectively utilize the law and justice system, not just in a correction setting, but all the other components that go into that. And so again, these are long-term conversations. We absolutely are having some great relationships, and the courts, the DA's office or the prosecutor's office and others are like, it's great collaborating like that because it helps solve problems sometimes on their end that they didn't quite know. And so as you look at the external, there are things that we can't control. Just internally is what we can control, but we're definitely working on with those partnerships. We have about 120 or more external relationships, partnerships with different groups that are just waiting to be able to have more space in the jail to bring their services and programs into the four walls that we have with our inmate population. So externally, I think Anna is going to talk about that just a little bit, as we've already talked about some of them.
Certainly. I know that there has been attention paid to the concern about releases from the jail. The jail is required to release people when the court designates a person to be released. Unlike a hospital or other system of care, we are not allowed to continue to hold them. That's a violation of that person's rights. And certainly sometimes that creates frustration with community partners and other groups who have concerns about the vulnerabilities of the folks that are incarcerated with us. And so it creates a point of discussion where folks are saying, my goodness, how are you releasing this person from jail? And the jail is saying, and we have no option, right? We must release them because the court has decreed it so. And so continuing to have conversations about what does it look like to have placement in the community that is available after hours that can quickly take some of these folks, again, it's voluntary, but where they might like to go. conversations about how do we better integrate between systems of care. Most of the folks we serve in the reentry program and some of our other efforts, they don't just have one area of need. They have all of them. Mental health, substance use disorders, issues with housing, issues with trauma, often complex medical care, and other factors. So really promoting conversation and integration in our partner network. Director Shook spoke to community resources. We have lots of folks who would come in and provide service and connection during incarceration, but they are unable to do so because of our physical space. And so really trying to make the conversation be more than the jail alone, but how do we work within our community networks to hear the gaps that we see, the needs that we experience. We have human beings that some of our providers have never seen before. They're not in services with anyone, or they've burned every bridge in town, right? Because their need has been so big. There are no providers who want to take them. How do we continue to have those conversations so that folks have places to go, places to connect for care when they leave? We also want to make sure we're always looking at how we can improve internally. You've heard us speak to the Medicaid waiver. That is a staggering change that will be coming to jails. There is much information we are still waiting for from the Healthcare Authority, but certainly as we receive it, we're doing everything we can to try to figure out the best way to implement and expand care to folks that are eligible for those services. That really intentional examination of our current model of healthcare. What does that look like? What do we need? Certainly the jail reflects the need of the community. So the impact of an aging population, the increase in complex medical, the experience of the fentanyl epidemic. We get all the things our community sees, but we get it often to a higher level of acuity and in more of our folks. So making sure that our healthcare model is best identified to support that. Looking at our mental health program, trying to move past crisis and triage, right? To actually get people some care while they're with us. And then really maximizing access to medication for opioid use disorder, and then alcohol use disorder medication is also being included in that cluster that has both medical and operational considerations.
And just one last point about what she said. Oftentimes, if she's working to transition people out, it's you're too sick, dangerous behaviors, you're not sick enough, we're full. Those are often things that we hear, right? And so again, at the end of the day, a court says time to go, or it releases person, or the process has gone through. We oftentimes end up with an adult mobile crisis person coming over to evaluate, but that's not always appropriate, but that's all that we have available. And so again, when there's not a lot of resources, and again, it's not always just about housing, it's about the mental health or the mental illness acuity aspects. And again, the external programs doing fabulous, but they're full. And that's what we often hear. So we're kind of stuck. And so we're trying to figure out different ways of creating those relationships through some of these efforts and through many of the other brainstorming efforts that our transition team, our reentry team are having with those external partners. And again, oftentimes most people go home at 5 and we are a 24/7 facility. So next slide, Michelle. And I think just really want to let you know that we have a unique opportunity to provide care for these folks differently. We don't want to be a mental health hospital. We don't want to be a medical hospital. But while they're there, we have some requirements to provide those services, some of those reentry services to maybe be less impactful for when somebody releases locally is one of our goals. And so again, as we continue to look at all the nooks and crannies, programs, places, and employees in different positions, that's always on our mind as we continue to hopefully improve the systems within the Clark County Jail. So any questions?
Thank you. Counselor Little?
Yeah, I just want to thank you for what you do. It's a hard job and there are so many people in need, and we just want to support you in any way we can. And we know the existing jail needs to be improved and expanded, and anything we can do, come to us, and I'd love to help any way we can. Just thank you for what you do.
Thank you.
Thank you. Counselor Little? Oh, I'm sorry, Young?
Apparently I've had it on for a little while. Just same thing. Thank you for what you do. I've said it many times. Absolutely appreciate the direction we're going. Just on your comment there that we don't want to be a hospital. The reality is, unfortunately, we are, and we must to some degree, just given society in general, and the way things are and the lack of resources and prevention. Also, just wanted to make a comment, and I appreciate very much, along Councilor Little's comments too. It's a tough job, and I appreciate the intent action that you're taking towards officer wellness. And it kind of comes back to the discussion we had earlier. I can't even imagine the boost in wellness that's going to come just from the jail remodel. It is such a dim, dreary place that I don't know how anybody can get better there. And I don't know how people can go there day to day to day to day and not come up with some wellness issues. So it's all tied together. So I appreciate the update. Thank you for the good work.
Thank you.
Counselor Belcutt, do you have any comments?
No, I don't.
Okay, thank you. Thank you very much for your leadership. I know it's not easy to be on the forefront of figuring these things out so that we can provide the very best service and really work with folks so they can get the treatment and be rehabilitated to the best that we can provide. So thank you for that. And I know we had a meeting with our Congresswoman Glusenkamp Perez. And so for all of the officers and staff that participated, just let them know we're grateful for the work that they're doing. So thank you very much.
So I just wanted to, today I was advised by one of our employees that she has requested or invited her to come and be a part of the State of the Union address by the president as representing corrections for the state of Washington. So we just heard that today.
Wow, that's great. Thank you. Okay, we'll see you later.
Council,
And-
do you need a 5-minute
Oh.
break before the next
Does
work
anyone need a
session?
break?
It's
Oh.
up to you guys.
How about you?